It's kind of like, why is this vast population of individuals, when it comes to healthcare, which is vital, is getting left behind, right? I know there have been talks about innovation, like maybe working with Dollar General or other, small retailers in rural communities to provide healthcare. I'm wondering, obviously, with the closure of these large, healthcare systems in rural communities, we're saying telehealth is a potential option. So because of the distances, they wanted to provide telehealth options, and that propagated throughout recently because of the need for, access to care in cities. But I'm just curious, as you've been in this area for such a long time, what are you seeing that could potentially work when you kind of think about the problems that's faced with it? Telehealth is a solution, partnering. What are your thoughts around how can we help communities that really aren't in bad shape right now?
The rural hospitals, they're in a pinch, and there's a number of factors. If you think, I mean, if we narrowed it just down to, say, like MRI, if you're in a rural area with a high poverty rate, there's a number out there. And if your payer mix looks a certain way, you can't have an MRI because CMS is going to pay a certain rate, and you have to have a mix of different payers. So if you don't have that, you don't really get to operate one. Then you're sending all your patients to a large area where the mix allows that. So we've got to get innovative out in rural. We got to save money however we can. And we can do a lot of that on the technical side. But the folks who are successful, surviving and thriving right now, they're doing it as a group, and they're constantly mindful of that. And the bottom line, it's a breakover point about 80, 100 beds. The whole thought process and way of doing business is it changes there. Smaller than that, you're in constant contact with folks in your consortium group, friends in the industry, and you're honestly always got a pulse on that bottom line. It's hard to find a MD or DO to come out and practice in a very rural area. And that next generation, it's going to be even tougher. If your hospital isn't in existence, you're going to have a harder time attracting those folks. And, talking about a very rural community, especially one with those same compounding problems, poverty and the payer mix the way they are, then it makes it even more important. If you lose that facility in your rural area, and, there have been a number of reasons, even when the big systems come in, or especially when the larger systems come in, they fly that banner, try and do rural healthcare with an urban mindset. And a lot of times, even that doesn't work out. Then the community's left to decide if they're going to shutter that hospital or try it again on their own when the larger system leaves. Of course, it's an impact to the healthcare you can deliver, but you're pushing the cycle even farther down the poverty track, because rural community hospitals a big and important employer, economic driver for the town and the region, really.